Welcome to our wellness talk today, and my name is Dr. Alita Moonen, and I am the Director of Organizational Employee Development here at the county. And for those of you who are watching from afar, welcome, and please remember you can ask questions too. So I'm very much looking forward to this talk. I'd like to welcome the team from Metro Health today, the Skywell program, and all of you who are here in the room with us. So I'm going to introduce Dr. Seeholzer, who is the medical director of the Skywell Workplace Population Health Team. She and her team help companies with workplace well-being efforts through wellness initiatives and benefit structure and workplace policy. Dr. Seeholzer has more than 10 years of experience leading employee workplace wellness efforts at her company, Metro Health, as well as with all Skywell clients. These employee wellness initiatives have been recognized many times at the state level with the Healthy Ohio Awards. The Metro Healthy Employee Wellness Initiative, co-founded by Dr. Seeholzer in 2010, has been recognized twice nationally and shown to have a positive value on investment. Dr. Seeholzer is a professor of medicine at Case Western Reserve University School of Medicine. She's the medical director of the Metro Health Weight Loss Surgery and Weight Management Center. She founded the Medical Weight Management Center in 2004. She's also the co-author and medical director of the STRIDES Diabetes Prevention Program, recognized by the CDC. Dr. Seeholzer is board certified in internal medicine and obesity medicine. She is a faculty member of Population Health and Equity Research Institute at Metro Health. She has a Master's of Science in Health Services Research with a concentration in quality improvement. Seeholzer's nationally and locally funded projects center on, first, developing and implementing tools, programs, and systems-based interventions from clinical to community settings that help all kinds of people engage in and sustain healthier lifestyles with a focus on obesity and metabolic syndrome. And she's supporting the professional development and job satisfaction of advanced providers to effectively lead high-value, patient-centered, team-based care. Please join me in welcoming Dr. Eileen Seeholzer.
Is it on yet? We're good? Okay. All right. Alita, thank you very much. And Alita and Tamara, who are the intrepid heads of the Cuyahoga County Employee Wellness Initiative here, I want to thank them for their partnership since this fall. Just a moment so you know who's talking at you for the next hour and hopefully with you for a significant portion of it. I'm particularly proud and excited to work with Cuyahoga County. I am a lifelong Cuyahoga County resident. So, and I fully recognize that from aging to zoning and children's health services and courts in between, that the Cuyahoga County employees really are the heartbeat of what keeps our county okay for the most vulnerable and for all of the quality of our lives. So I want to thank all of you for all that you do. And hopefully today we can share some information that is both useful and compelling and can help you guys take care of yourselves because you do important work, but it's really important you take care of yourselves as well. So if we can go to the slides. There we go. So Alita and Tamara, when we were designing the program with them to get the program they wanted to offer folks, wanted to talk today about what living well with chronic conditions is like. And so today we're going to talk about a few different things. The key topics today are talking about defining chronic conditions and what that means. I think people hear it a lot, but I want to be specific because it's not so mysterious, but want to make it clear. Secondly, want to talk about what you've shared about yourselves one by one, put the results together. You guys have actually been amazing participants so far early this year. Also then want to talk, and this is really key, and you're going to hear this over the next decades, for those of us with chronic conditions, this concept of self-management and basically how we govern and lead our own health amidst all the stuff going on around us. And the thing that's nice about talking about self-management is 90% of it applies no matter what disease it is, and then 10% of it is condition specific. So I want to kind of, again, take that mystery out of the components, so people can, again, really know what elements they should be working on and what's there to expect. Then want to talk about being well with chronic conditions. My best friend in medical school, one of my best friends was diagnosed at 22 with high blood pressure, and I certainly don't think Chris felt like he was going to not have a good life after that. It's really important to understand living well with and preserving our health and our quality of life long term. So I want to talk about wellness with chronic conditions as opposed to just prevention. There we go. Hold on, let me back up one more, sorry. And then want to talk about how your wellness program kind of supports you doing this. And that's one of the things in Tamara and Alita's design is really they wanted to make sure there was an explicit link between engaging you in self-care for those conditions so that the things you're already doing that are the right priorities are what get the credit for the program. And that alignment is really important. And last, want to talk about what are the supports that are out there for living well with chronic conditions. We will not get through all the slides, and that was purposeful. I wanted Alita and Tamara to have kind of a basic level set for the year. So I will tell you the slides are available through them, but I want to make sure we talk about some things a little bit more in depth. So first of all, what is a chronic condition? So chronic conditions are diseases or conditions, and that is used interchangeably, chronic disease versus chronic condition, that typically last over periods of years, for which there may be effective treatments. Right now, many diseases, which even when I started medical school, for which there weren't medical treatments, like multiple sclerosis, there are now effective treatments, rheumatoid arthritis, right? So more and more chronic conditions are not just things that, progress, but are things that, for which we have treatments to make things better as we go. And those effective treatments reduce symptoms, prevent complications, and reduce, in many cases, the risk of progression. But the most important part here is we don't cure them. It's not like an infection, right? And so, again, every condition is different, and what we have available for it's different, but the idea is that this is something we need to tend to long term, which is different. And in many cases, and this is what's really important for busy adults who care for everybody else, not consistently engaging in that active management will worsen people's outcomes. And the longer they go without actively managing or engaging in that care, they're going to suffer the consequences. So I want to really talk about that reason to stay engaged in chronic care management. Chronic conditions are conditions that impact a person's life and functioning over time. Usually that's an escalating course. And chronic conditions may require monitoring and management measures. The simple way to think of it is in high blood pressure. We have those monitoring readings, right? You check that high blood pressure. You get that blood test for your kidney function once a year. For asthma, you may do a peak flow monitor, but there's different measures. So these are things that are typical for chronic conditions. The other piece is chronic conditions, with rare exceptions, are usually not communicable diseases. Again, they're things we manage and have. One thing that is, in the 90s, we couldn't have imagined this was the case, but HIV is the one significant exception to that. With the changes that have been made, now people live many, many years with HIV. So that is the one kind of disease and infectious disease exception to the chronic condition rule. But whether it's mental health issues, one of the things that's remarkable, and I think many of us know, advanced cancers, which literally just 10 years ago were things in which, we're talking 1 to 12 month prognoses for, with the start of immunotherapy, are now things, again, people are living with for many years. So things that we always thought of as immediately progressive and fatal, again, are now becoming chronic conditions, HIV and cancers among them. So due to the new options for treatment and improved disease management, people are living longer with more conditions, right? And so this is a different age for us, and it's the things we asked for. We wanted treatment for these things, and now we're engaged in it. So the CDC says that, and this is an interesting, because you guys look like this data, so is that on average, about 6 in 10 adults have at least a single chronic condition, and 4 in 10 adults have more than one. And so a simple way to think about that is if you have a high cholesterol and hypertension, you would count as having 2, right? If you have hypertension and some mild anxiety, you would count as having 2. And so none of these in and of themselves are necessarily crippling, but they're things we have to keep our eyes on, right? What's really nice, and you'll notice this has nothing to do, and you'll see the expanded version of this, nothing to do with which disease. Thank goodness there's a lot of, for all these diseases, a lot of data that shows that some core human priority behaviors that we all can do among us can really help improve all of those things. So one is whatever that disease is, getting regular health care. For diabetes, that may mean 3 times a year. For high blood pressure controlled, it may mean twice, but whatever the regularity is for that condition, right? Stay physically active. One of the things that has become, the evidence just keeps getting more solid and more solid, whether it's preventing cancer recurrence, whether it's improving arthritis outcomes, whether it's improving depression or diabetes or blood pressure. Fundamentally, physical activity is always showing up as an incredibly important factor in all these, and so to help each other become and stay active is really core. Same with eating healthier foods over time. So these are things culturally within a household. There's nobody who won't benefit substantially from these things, right? These are things we can work on together regardless of our individual challenges. And lastly, unfortunately, we need to be lifelong learners, right? Or fortunately, depending on how you come at this. But for all those conditions, things change, as we just talked about, and so there is that need to work with reliable sources to keep up on what your options are. So I want to talk about what you guys shared about yourselves. So this is data, and you guys know the program just opened a couple months ago through the end of April, although Denise and Ashley, of course, have up-to-the-minute data, but I'm never up to the minute. I'm always behind Ashley and Denise. One of the things that you guys do, at least 49%, I think, is of today, but this is the data for 47% of people. Is it 49, Ashley? I think we're at 49%. 48%, okay. Have taken that health risk assessment. If you've done your wellness programs prior years, you know that's usually part of it. I want to encourage all of you who are on today, present in the room or virtually, if you do nothing else in the next week, get on, please, and fill out that health risk assessment. And let me explain why. One of the things that's really important as I share the summary results of that next is that it's pretty impossible to understand what your needs are if we don't know about you. And so, Alita and Tamara never see the individual data. We get the summary data, right, and we share that. But that helps us know what's impacting you. It helps us know how to serve and what your needs are. And you guys know without information, we just can't customize to people's needs. So I would really encourage you, health risk assessments are there to help people identify and prioritize the medical conditions that are likely to cause major problems and help prioritize your efforts. So of the people that, you get that number at the end, the health risk assessment score, the average health risk assessment score is 70. So low risk is 75, I think, and up. So we're just into the moderate risk category on this one. But so that means, again, on average, people have at least some risk, which is typical in a working population, right? You're not at the high risk end and you're not at the lower moderate risk end, you're at the upper moderate risk end as a group. But it does mean that the average coworker is struggling with something. And more specifically, this is actually a top 12. I'll tell you what number 12 is in a minute. They're in order except for that one. So this was interesting to me because it looks exactly like a lot of what you'll see for national, state, and worker data. So anxiety, it turns out, is the most common mood disorder, hands down. And 1 in 4 folks who've taken the health assessment so far, of the 49% of people who've taken it, say that that's something that they struggle with or have to manage. The second most common one is hypertension. About 1 in 5 folks have hypertension. 16% with depression. Higher abnormal cholesterol, 14%. Obstructive sleep apnea, 13%. What I was actually really impressed with this is that means you guys are getting cared for and treated. A lot of times that number is falsely low because people don't know they have it. And so while I'm not thrilled that more than 1 in 10 people are dealing with it, because untreated sleep apnea leads to diabetes, high blood pressure, strokes, as well as driving accidents and all sorts of bad things. Knowing that you have it gives you the opportunity to treat it. So that was a kind of mixed blessing. Headaches, which many of us know can be particularly debilitating, 12%. Asthma, 12%. Hopefully our air quality will improve over time. Back pain, about 1 in 10. Diabetes, 6%, which is actually pretty typical in most workforces. Osteoarthritis, 6%, and rheumatoid arthritis, 4%. The 12th one on here, because most people don't know they have it and it's not yet part of health assessments, there's a diagnosis called prediabetes, which means the blood sugar is high enough where you aren't at the diabetes level but have a 70% chance untreated of getting diabetes. The prediabetes, the rule of thumb is that you multiply by between 3 and 4 to get the percent of people with prediabetes. So if about 6% of your population has prediabetes, then somewhere between 18 and 24% of folks have prediabetes. So again, back to that number, that's about 1 in 4 folks. So we have a list. One of the things about lists is now what? One of the pieces with this I would just mention is when people struggle with chronic conditions, and you guys know this, not just in your own lives, but for the people you serve, taking care of yourself or anyone in your family with a chronic condition is immeasurably harder when you have other barriers on top of it, right? And so at Metro, and we've done this too, we've taken to asking our employees to do a social drivers of health risk assessment, and that was part of yours as well. And this is the things that you guys talked about as challenges in your day-to-day life. So in this question, it was asked what people are dealing with, frequently in their daily life. So this is not like a once in a while thing. And I think this is important because even though numbers are small, when you think about them as being part of daily life, that's big. And so this is your coworkers, right? This is people with benefits eligible jobs, so half-time or more. 17% are really struggling with stress about work. And, I will say I'm probably the other institution in town that may have a higher stress about work level. And we all know from the past 3 years to 4 years, some of that is the work itself, and some of it is the fact that there's been incredible disruption in the workforce, right? And some of that may be normalizing, I wouldn't say leveling out, but it has been a really rough ride, and we really recognize that. 1 in 10 with carer responsibilities, and that could be, substantial, caring for somebody else, and there's, whether it's a child, a parent, or somebody else that they care for. 3% affordable housing. Even in Cleveland, which you guys know is not known for unaffordable housing, we're actually known as a pretty decently valued place. Building and maintaining healthy relationships, 7%. Finding and maintaining a quality job, 1%. Feeling safe in our neighborhoods, 1%. Paying daily living expenses, just daily, and we all know there's been inflation, 8%. Managing and paying debt, 17%. Managing family health problems, which is different than carer responsibilities, right? You may not have a carer responsibility, but you may have to deal with diabetic supplies or whatever. That one's 9%, right? So that's a pretty significant one. Getting health info, sorry about this, from providers, 9%. Having outdoor places that are safe, 2%. This one seems low to me. Facing discrimination, racism, or stigma, 1%. And reliable transportation, 4%. And I bring these up and would really love to see more data from folks because, again, any chronic condition we just said is something we have to do as part of lifelong care. These things often have to be managed first to make that other care possible. So we recognize these go hand in hand. Lastly, about you guys, again, the print on these is small. That's not the point of it. The point is actually on that graph on the right, if you add the red and yellow up, and if it passes the halfway mark, that means that more than half of people are significantly dealing with those things. And I'll just point out that, the big things are struggling with what we talked about for preventing chronic disease. Physical activity, struggling with obesity. Now, obesity is not a behavior. Obesity is a chronic disease itself. And those things are still not reflected in the questionnaires, but it is. And I bring that up because that means 70% of people have one chronic disease that then affects other things. Work productivity, more than 50%. Smoking, this one, I just want to encourage you, and we have some smoking resources. At 24%, you guys are actually above the county average a little bit as smokers. And I bring that up just because it is such a health impact. And so that's something that your benefits plan does have resources for, and it is so worth your time if you can work with that. Another one that's big in there, again, the stuff we talked about before, is eating well. So these are things we can work on together that help everybody. I already talked about the moderate score at the bottom, but just wanted to kind of put together all those big numbers at the end. So coming back to chronic condition management, again, for most folks here, they're dealing with one. And so what you're going to see increasingly in your health offerings and in your wellness program advertised are things that are called self-management programs. Just show of hands in the room, how many people have heard of self-management programs? Not. Okay, Alita, but Alita doesn't count. I mean, she counts, but not for this. And that's really why I wanted to spend some time on this when Alita brought this up, because you're going to increasingly hear about this for all sorts of conditions. So self-management programs are programs that are proven to basically help you regulate and manage a chronic disease condition and the risk factors for progression and from that condition. So when an individual is affected by a chronic condition, we all know it doesn't ever just affect that one person. It affects all members of the household, right? I mean, there's always some impact. Self-management programs are interventions that are designed traditionally by healthcare professionals, but there's a concept we're working with in a lot of places we work with now called co-design or co-production, where we actually work with patients to modify or co-design things as we go. So I'm thinking this is going to be something that, over time will improve the offerings. But the intent of self-management programs is to prepare persons to assume the responsibility to manage their illnesses by engaging them in health promotion. So not just doing things that don't make things go wrong, but actually help your health as well. This is this idea of wellness with chronic conditions. And examples that are proven are the diabetes self-management program that's been around for 20 years, reduces amputations in diabetes, reduces blindness, reduces kidney failure, reduces neuropathy, reduces costs to the family. Well-designed program. Most people with diabetes have never done it. Another one that you've probably heard of, what we know takes place is if somebody has a heart attack and people complete a cardiac rehab program. That's a self-management program. Those have been shown to reduce a second cardiac event. One you'll be hearing a lot more about as it becomes more nationally available and is available through your program soon, we hope, is the diabetes prevention program. That's a nationally recognized 1-year program that reduces the risk of diabetes by 50% if people do that. And so that, depending on, situations, may be combined with other things, but that is a behavioral program. So these are the things that empower people to care for themselves. Self-management programs basically all have the same 12 things, back to the beginning that we talked about, same 12 components no matter what the disease. And this is, again, kind of really understanding, whether it's you or a family member, what should I know to take care of myself? What are those domains or those pockets? So one, no matter what it is symptom management. If you have a seizure disorder, you need to know what the symptoms are, right? If you have diabetes, you need to know high blood sugar symptoms and low blood sugar symptoms. If you've got migraines, you need to know what the auras are and the meds do, right? So it's whatever it is for that condition. The second thing is how to take medications correctly. And in other cases, it might be getting procedures or surgeries that are appropriate to improve things. The third thing is recognizing, bad episodes. I mentioned seizure disorders, whether it's a depression exacerbation, whether it's a pain exacerbation, whether it's a blood sugar exacerbation, but kind of any self-disease management program is going to help you know kind of what's typical, what's worse, how to manage it, and then in the context of that, what the role of exercise is. Every one of them, the outcomes get better when we stop smoking. Interaction with healthcare providers, how to advocate, how to ask questions, how to communicate. That's a really big deal because it's really been shown that that's often what keeps people from really getting the information they have. And these programs really help patients learn how to ask, how to talk, how to inform their providers what's going on with them. Getting needed, dependable information. This one's really important to me in an employee wellness standpoint, adapting to work. Most people want to work and want their work to be as uninterrupted by chronic conditions as possible, right? In the age of post-COVID, where there is hybrid work and other things like that, there's now reasonable accommodations that can keep a person productive, often in jobs, and how do we talk to workplaces about that, right? And so this is really important because it can really help people have their lives. Managing relationships and managing emotions, because the reality is it's a big deal to deal with this stuff. So again, chronic conditions often and increasingly will have self-management programs related to them. And those programs usually can help people when they do them kind of get an immersive course and get better at things. The second part, so there's the knowledge stuff, right? There's the 13 knowledge things. That's the what do you know, right? This is the how do you do it. And I will tell you the how do you do it is 60 million times harder than the what do you know. I'm in the diabetes prevention and obesity world, and my least aware patient, who's been, some single guy who's been living in a cave, paying no attention to anything, even he knows that, carrots are better for you than cake. Knowledge, it's important, but it's usually not the key. It's the how to do it. How do I do it in emotionally charged situations? How do I do it when I'm stuck on the road, as a visiting STNA or visiting a helper in some place? How do I make decisions that are emotionally charged? Or if I go to a public place and they don't have what I expected, what do I do if I'm on the road? What do I do in family situations where I've got to meet their needs and my needs, right? Those are the tough things. What resources might I have that I didn't think were resources at all? This is always interesting to me. People have a lot more assets and strengths than they think they do. Formation of patient-provider relationships. How do you do it, not just what to do? And development of action plans. How do you take those kind of squishy concepts into what I'm going to do tomorrow and what I'm going to do this week for my grocery list? tailoring it. If you don't like to cook, then we're not going to give you a cooking plan. That's really stupid. Why don't we make a plan for pickup food that's better and affordable, right? And so the idea is, one of my patients, I remember, not long ago was, she was working full time, she had kids at home, she was caring for her mother, and she was going to school. And she said to me, so I should be making home meals? I'm like, not on your life. Like, that's just not gonna fit, right? That's just too much. And so this idea, not that if she has one day you don't cook, but you don't make the baseline plan something you can't achieve, because then what happens? You end up picking up fast food. And so this is what works over time, what works in different conditions. And so one of the most beneficial things about self-management programs, there's a reason I'm spending time in this slide, is the how-to. And when you do it over time, you learn how to do it during family reunion season, and during the holiday season, and during, the back-to-school season or the travel soccer season or all that kind of stuff, because you need different skill sets for different times. And so I think that that's one of the things that, just to know that self-management programs over time are most helpful with, is the how-to under different circumstances. This is the last thing I want to say, and this is just from my experience with chronic conditions and the emotions of them. And we'll talk more about lists and stuff, but this I find is a really big deal emotionally for patients, and I just wanted to spend a few minutes on this. One of the things I have a lot of times patients talk about is, I don't want to take medications for my diabetes. I don't want to take medications for my blood pressure. I hate my CPAP. And it's kind of an understandable emotional hand to the face. I'm just going to walk away from this because I can't really see it anyway, right? And I just, as we're dealing with our emotions and stuff, one of the things that I talk a lot with patients about is, when we have a chronic condition, we can influence, we can't control. I mean, I can't control anything. But we can influence how we respond to having it. Whether or not we have it in the first place is not something we can control. Once you've got asthma, you've got asthma. I can't un-asthma you, right? That's not an option. I would not recommend at that point buying 20 cats and starting to smoke, but the point is once we have it, we have it. There's no, and this is also good to be compassionate towards, partners and family members going through this. This is a pretty emotional thing. The second part is that chronic conditions don't stand still. I wish they did. Blood pressure, even when well controlled, can still have complications. Diabetes, even when well controlled, can still cause complications. Much less often than if it's uncontrolled, much slower than it's uncontrolled. But again, there's parts we can influence and parts we don't. We can't pick our genes, we can't pick our age, right? Those are things we have. There's things we can influence. And so, one of the pieces that's important is to kind of be at peace with, I do have influence. I don't have to feel helpless, but you also don't want to beat yourself up over having a condition. Nobody raised their hand in 3rd grade and said, I would like the high blood pressure and the depression, please, right? That's just not how that works. So one of the pieces is you could get to be frustrated about having the disease, but you do have options. The second part, which is kind of the next part about that, which is you can choose, and I tell patients that you can choose to take the medication or not. You can choose to make the lifestyle changes or not. You can choose, but when you make that choice and how deeply you make that choice does have an impact. One of the things is, if people go and don't come back and their blood pressure's been running 160 over 90 for 5 years, we're going to be in a different place than if we got it in and were controlled to begin with. And so really encouraging people to get in early, because people want to avoid bad news, and I get that, but you can avoid bad news better by addressing things earlier, right? And then the last part that's just kind of a funny thing is, when you're working with medical and mental health challenges, it's really normal to be frustrating that you have that challenge to manage, but do your best not to be angry at the treatment. So one of the things I hear a lot is people will get very angry at the medicine or the CPAP or the other piece. And I understand it's not necessarily delightful, but you have to understand, I'm so grateful that we have things to do about it. I would much rather have somebody with multiple sclerosis struggle with dealing with side effects of whatever the treatment is than be in a wheelchair and be disabled within 3 years, which is where we used to be before, right? And so one of the pieces is, again, you get to complain. One of my favorite administrators I ever worked with says, I'll do what I have to do, but I get to complain about it. But treatments will get better over time, but really work hard to engage yourself in the treatments as you can so that you can reduce the impact on your health, because walking away from them, only you pay the price, your providers don't. And the last thing I would just say is, when you address or do these things early on, you're more likely to have the life you want and not get sick unexpectedly or earlier. So anyway, that is a little bit editorial, but it is based on conversations I have had so many times, and we don't really talk about the emotions of it. And they call it diabetes distress in some cases, or, you know, stigma around mood disorders, but there is a lot of emotions around having these things, right? Because we can't cure them. So where do wellness programs come in all this? Because, you know, this was a big leap for me as, you know, as an internist. You know, we like data, we like medicine, and we like lists. And wellness programs have a lot of feelings involved, and that's not always so comfortable. But wellness programs, employee wellness programs, when done right, really kind of support you as a human being at work, and not just you as a worker. And, you know, so one of the things I liked when we looked early on with applying to support you in this, you know, your human resources mission here is to attract, recruit, develop, motivate, and retain a high-performing and diverse workforce while fostering a healthy, safe, and productive environment, which is the perfect wellness mission, right? We want to keep a diverse group of people who are excited to do the work that really serves this community, right? You can't do that if you're not well, right? Just can't be done. And so wellness is an active, that's why wellness is part of the HR process, right? It's an active process through which people become aware of, hence talking about chronic conditions and self-management programs, and make choices toward a successful existence, a healthy existence. And so what you'll notice is it's make choices toward, not we've arrived at, right? It's all the journey thing. And so, you know, one of the pieces on the well-being model, and that's why you'll see with wellness program offerings, that the offerings are not all diet and exercise. Because it turns out if you look at humans and how we live well longest, it also depends on social connections and not having social isolation, right? It includes mastery and aspiration, which is why education is sponsored here, right? It includes, and mental challenges and jobs and outside is really important. Financial wellness, because we can't even think if we're terrified about losing our house or losing our car or things like that, or having enough for what our kids need. So well-being is the whole concept of those wraparound methods. And that's what a wellness program is able to do that a healthcare system can't. And so that's what's really neat about a program that's being able to be offered for employees. And so the science and that model are what Alita and Tamara look at when they decide, you know, does this help people achieve their full potential? By full potential, it's that well-being model, right? Does this recognize and address the whole person in that multidimensional way? Does it affirm and mobilize their qualities and their thoughts and their individualities? So all that being said, is we have 22 or a little more minutes left here. I always laugh at this because it seems like a very funny phrase because it's simple and it's not, right? All we have to decide is what to do with the time that's given to us. We all have 24 hours in a day. I can't think of a harder question I face every single day of my life, right? I just always want to throw rocks at that phrase, because part of the issue is we have some things for which we can decide our time about and some things which we can't, right? And so I don't know any of you, but raise your hand if your life is like it was 5 years ago. Raise your hand if your life is like it was 6 months ago. I got no hands for the people out there, not one hand in the audience. And same for me. One of the things that's really important, so we go back to chronic conditions, right? We have to become lifelong adapters, which is so highly irritating, I can't stand it, right? We have to be relentless changers, but we have to change smart. And that's why having that priority list from before matters, and those skills of how matter. Yes, I need to exercise, but with my ever-changing schedule and kids' needs and other things like that, how, when, and where I exercise never stays the same. Yes, I need to be a healthy eater, but when your kids got after-school events 4 to 5 days a week during the dinner hour, how do we do that, right? How is that actually practical and possible? And so one of the pieces here is to try to not be, again, you can complain, but to try to not be too, to not expect that you make the perfect plan. It's more that you're always planning with priorities. So this adaptability mindset is really important to people's happiness, because otherwise people just get frustrated, right? So it's actually, you know, the Nolan Ryan quote I really like, enjoying success requires the ability to adapt, because only by being open, again, not changing, but being open to change, right? Not angry about change. Do you have a true opportunity to become, as I said to people, I have not stopped having a learning curve. I just wish it wasn't always vertical. You know, the thing is we do need to become lifelong learners, but a lot of that learning may be the learning in how to do things in our community world, or in our parenting world, or in dealing with adult parents world, or in dealing with our job world. There's always changes, and expecting that and playing with that works better than resisting that, because it's going to change either way. And so I bring that up because that's the challenge of chronic disease management, is that you're always changing, the people around you are always changing, and yet you've got to maintain those priorities. So this is that mindfulness, right? So what I always tell people is, you know, and we'll get to this a little bit later too, but don't think about, I don't have time for that. You don't have time for everything. Nobody has time for everything, right? But you can choose how to use some of your time. You can choose what's most important. How many have heard from a savings account standpoint, when you get your paycheck, pay yourself first by putting money in the, okay, I got hands on that. See, that one I got. Self-management programs, not so much. So one of the books I read a couple years ago by a journalist on the East Coast called The Overwhelm, who was writing about women and time management, or lack of time management, actually, talked about applying that to time, that we have to set aside some of our time, like a savings account, regularly for those priorities that affect us, because if we're not okay, everything else in our roles in life isn't okay. And we aren't helping anybody if we're miserable, so even our happiness matters, who'd have thought, right? So this idea that you don't have control over all your time, but you do have responsibility and influence over your time. And so this idea of we need to take back leadership in our lives. We forget to do it. We just kind of do the next thing on the demand list because they're asking us to do stuff at work, and then our kids are asking for stuff, and then our family members are asking for stuff, and then the place we volunteer is asking for stuff, and we just say yes. We need to lead ourselves. It doesn't mean you always say no. It doesn't mean you always say yes. It means we have to be thoughtful a little bit. So this leads to kind of staying well with or without chronic conditions, and that's where wellness programs, again, can provide that set priorities that work, whether it's dealing with chronic condition you have or preventing yourself from getting other ones. So it's prioritizing healthy behaviors with the time we have. And you know, I tell people what we're looking for is better, not perfect, right? I would love to get to optimal, but it's not happening this week. Staying connected socially to others that matter to us and ourselves, right? And you know, one thing about technology is it's easier to do that than it's ever been, right? And that's actually one thing that's really helped. Healthy eating, activity, and sleep. They're the mantras, but you know, it's just like caring for babies. You got to move, you got to sleep, you got to eat. We still got to do that for ourselves. Stress management, that we will spend a little bit of time on, because I feel like that feels mysterious to a lot of people and squishy, and there's some really practical ways that we can just reduce stress that are not very complicated. And they really do have a physical impact on us, which helps us respond as opposed to react in our jobs and our lives. And they really do help our cardiac risk and other things like that. Avoiding unhealthy coping is just as important, right? And if we can reduce stress, again, so we can think, we're more likely to step away from unhealthy behaviors we're trying to step away from. And again, one of the pieces with helping others is it's actually really good for us to be involved in others' lives, but that balance has to be in such a way that it doesn't harm us. So my partner always says, you can't get what you need until you get what you want. So again, we need to have self-care, because if we don't, you know, we're not going to get where we need to get. So I'm going to go over, this is from our Strides program a little bit, and then we'll get into the other list of stuff. But one of the concepts my partner who co-wrote it, so the Strides program, which is a diabetes prevention program, was co-authored with a psychologist who was a really terrific and insightful guy named James Oakley, or Jim Oakley. And he worked with groups from adolescent ages to older folks, from rural settings to urban settings, to all sorts of economic and social and ethnic settings, and really was somebody who worked with people where they were at and that were common across human values. And one of the things he worked with a lot was this concept, not squishy, but very actual, about what it means to be your own best friend. And basically, in order to do that, you have to have three things. You have to have a relationship with yourself that involves honesty, concern, and responsibility. And these are not squishy concepts. These are very concrete concepts. And Why do you need that? Because you have to help you stick with decisions, and changes is a priority. You know, one of the things about grown-ups is after you're 25, you're not supposed to complain about your parents, right? You get what you get in life, and then you got to go get the rest for yourself. That's what grown-ups do. And we have to be our primary keeper unless we want somebody else to be our keeper, right? So that's a big deal. So what does it mean to be your own best friend? So honesty, and think for most women, honesty/awareness. Again, busyness often prevents us from being honest. So it means really learning how to change our situations and dealing with what we call high-risk situation. By high risk, I mean high risk for unhealthy behavior. When I might go without sleeping, when I might not eat how I wanted to, when I may ditch my exercise, when I might, it's those kinds of things for high-risk situations. It could be much more serious than that, but on the day-to-day, it's often those kinds of things. And so it's the things that get us off track. And it may mean avoiding them, but it may mean we prepare for them differently. But one of the things over time and self-management programs help us do is that they really help us with honesty as a work, as actually looking at, why am I not exercising? You know, is it because, you know, when I come home every day, I'm going to be tired, I need to go right to the gym? Is it because I need to do it in the morning? Is it because all sorts of things, you play with it. But we have to look at it and be honest with it and own it. The second thing is concern, and helpers, and county workers tend to be high numbers of helpers. Helpers tend to not be great at this to begin with. We're really good at helping other people. We're not really good at helping ourselves as a group. And one of the things that helps a lot of people move from not caring appropriately about themselves is really thinking about the golden rule applies to you too. And you know, a lot of people are raised where it's okay to talk badly about yourself or to yourself. It's not. That actually affects our brains. It actually keeps us from doing what we need to do for ourselves. It's actually harmful. And so one of the things that begins with is first being kind to yourself. One of the things that's really interesting is psychology and counseling really can help people when they've got those tapes in their head that have just been ingrown from childhood on. And this is often the first step people really need to make in self-care, is really helping to shift that conversation of, you get to be good to yourself. If you're going to be good to other people, you get to be good to you too. You're not putting yourself above anybody else, but you're one of the people you get to be nice to, which then can lead to caring for yourself, right? And one of the things about this is caring for yourself has to at least be equal to caring to others, which again, for many people, is a radical change for what they're doing. You know, one of the jokes I have is whenever I feel like I'm way too busy to do anything, I always laugh a little bit and think, how is it that me walking for 40 minutes or doing yoga is going to make the world stop, right? I'm really not that important. And so I laugh at myself a little bit, but it's the other side too, right? People may complain. I always tell people with kids, having had kids, but that burns calories, it's okay. But you know, one of the pieces is your job isn't to make everybody else happy. That's not our jobs. But we are supposed to care for ourselves as part of the next. And so we're not asking anybody to be their only priority, but to be a priority. And to really, again, recognize and foster for their own families that self-concern is a responsibility. That is really culturally what, you know, think about the social workers who work here. That is exactly what, you know, many of the workers in Cuyahoga County are really asking people to do. And so we get to do it for ourselves. And the last piece, which is interesting, and again, with responsible people, it may feel the flip. It doesn't mean you're irresponsible. It means you're responsible for things that perhaps you might not, might be somebody else's job. So one of my experiences that I work with weight management clinics, so I'm often working with patients struggling with obesity, is these are like the nicest folks in the universe. And the problem is they don't have time to care for themselves because they're doing stuff for everybody else. So when I talk about responsibility, these are not irresponsible people. They're uber responsible people, just responsible for things that aren't theirs. And one of the things about that is it creates anger in us, even if we don't realize it. And because we blame other people over time for the situations that we're doing, even though we've kind of said yes to them, right? It breeds resentment. And we give control to others of our time when we say yes to things that we shouldn't. And really, we did that, right? We have to take that back. Again, self-leadership. And then we feel and act helpless about things we really can change. And so this idea of responsibility is we are responsible for leading ourselves. We are responsible when we say yes and when we say no, and for what that means. So we need to own our actions, and we need to own our satisfaction. And if we're not satisfied, we need to change things to become satisfied. And so they use in the class the response able, empowering ourselves, is to become more creative about our choices. And one of the biggest things a lot of people have to do is let go of things they're doing for other people that aren't theirs to do, and let the other person have that, I'm seeing nods, which make me happy, and have create in that person the pressure to do it themselves, because they're not going to feel the pressure to do what is theirs if you're doing it for them. And so one of the pieces that's really important in all the self-care, I mean, what does this have to do with high blood pressure? Often a lot, because it means you're tense and you're not managing your stress. It means you're not eating what you should because you're stress eating. It may mean you're losing sleep. It might mean, you're stopping out for food. All those things really come from doing jobs that aren't ours. So I do, being our own best friend, again, isn't this squishy thing. It's actually how we decide our time and what we decide to do in our time and how we decide to talk to ourselves. It's a very action-oriented piece. So with all that, what are the components, as you saw earlier, that really keep us well and actually help with chronic disease management? One is staying connected in helpful ways. Just remember that connection. It was great during COVID. They did these studies on pets. Anybody here have a pet? So it turns out what we all knew is true. Pets actually do improve mental health. I just wanted to let y'all know that. And people who have dogs walk more. We all knew that too. Funny study though, there was a study of dogs that if you let them sleep in the bed, you do get worse sleep quality. I'm not telling you what to do, but it is. I just thought it was funny they actually did a study on that. But anyway, it is really important to physically lay eyes on loved ones. If we can't, talking is the next best thing. And if we can't do that, texting. But the more senses engaged in seeing someone, the better episodically. So if you can see somebody physically and hear them, that's great. If not, hearing them is the next best thing. If not, words is the next best thing. But really, we do need to see people we care about. Time matters. You get quality time by having quantity time. And so that's part of our self-care, really. Similarly, I mentioned, pets actually really do reduce stress, so I just want to bring that out. And lastly, one of the people you need to stay connected with is yourself. Healthy eating and activity, we brought this up before. One of the things I will just say about activity and eating, but particularly activity, you need to think of these things as medicines. A bottle of medicine doesn't help if it's sitting on your dresser, right? It only helps if you take it. So physical activity only works when you do it. And so one of the pieces on this, we talk in the strides class about if I could give you a medicine, all of you have probably been in a vitamin store at some point or in the Giant Eagle nutritional area, right? That could extend your lifespan, reduce diabetes, reduce blood pressure, reduce cholesterol, improve your urinary continence, reduce knee arthritis, reduce diabetes, improve asthma. You'd be pulling out your wallet to hand it to me, right? Exercise does all those things. It also helps depression and anxiety. So it's really, if you're going to do one thing for your well-being to really just kind of stick with, it's a really big deal. And luckily now, between the YouTube, God bless the YouTube, because people have kids, they can't go outside, and it's Cleveland, not Santa Barbara. Everybody's got a living room, so thank God we can do free exercise in our house. Treadmills and ellipticals mean we can do exercise without killing our knees. The Planet Fitness means you can do exercise for $14 a month, right? Cleveland rec centers are amazing. So I point out, go outside on all 6 nice days in Cleveland every year, but on the other days you need a backup plan. It's really important. And if you go out in the metro parks, I just plug for Brian Zimmerman and his crew here. It turns out that exercising is its own medicine, like we mentioned. If you combine exercise with music, it's another medicine. If you combine exercise with doing it with somebody else, even if it's in a class, because I just like knowing that she over there is as sweaty and miserable as I am over here, it's a good feeling. That also actually helps things. So social exercise helps. Music and arts with exercise helps. Walking in the neighborhood helps, but walking in the metro parks, in Japan they call it forest bathing, which I think is like the best term ever, is also its own piece. So you can always layer and get those extra benefits depending on what you have available on those days. And again, food is medicine. We're taking in things that help us, are neutral, or hurt us every single day. The more we can move, not toward perfect, but the more we can move towards healthy plate eating, less processed eating, the better we're going to be in all sorts of ways. So those are in there. The sleep investment's a big thing right now. The biggest harm for sleep is electronics. Turn your phone off. If possible, I know this is like sacrilege, but don't have a TV in your room. It's a big deal to let sleep be sleep. So I would just really encourage people. it is such a big deal. One of the people I worry about most are my shift workers and trying to make sure they can catch up and have real sleep time afterwards. It's a huge deal on diabetes, blood pressure, mood, mortality, everything. Um, Managing stress. All right, we're still okay on time. I'm going to finish up with stress and then leave the rest of these as references, okay? Because I want to make sure there's plenty of time for questions and answers. So stress, I want to define it, even though like people say I know it when I see it. Stress is a normal part of life, and our body interacts with changes, and stresses change, and it's our stress response is our body's reaction to change. And stress is experienced physically, mentally, and emotionally in a combination. And although stress is often seen as negative, you can have positive stress. So limited, predictable stress, like starting a job, hopefully if you get married, having a baby, starting a school program, those are stressors. But if they're, again, they have a beginning, and then you should get in a kind of a normal phase with them, those are good stressors that help us kind of prepare, focus, and do things and perform a little better, okay? The stress that is unhealthy stress is stress that is unpredictable in its length, unpredictable in its severity, and really has an impact on our bodies that is detrimental. So unhealthy stress is when a person faces constant challenges that they can't get relief or relaxation between. They just keep coming on, and they're overwhelming, and it leaves us unable to cope. And COVID was a time where all of us kind of had it together, but this is something that happens to all of us at some period of our life, and we really need to identify. And sometimes you only identify when you just got the snorkel above water that, oh, this is really a period of unhealthy stress for me. If stress isn't managed, the problem is you can have all those health conditions get worse, right? And exacerbate, and then you have another stress on top of the stress. And the unhealthy ways that people deal with stress on top of it can then exacerbate things further. We smoke more, we drink more, we sleep less, we eat more. We isolate ourselves from other people when that's the thing that could help us, right? All those things that pull us away from that well-being model are unhealthy coping skills. And it matters because, again, cardiovascular disease, cancers, all those things are associated with increased long-term levels of stress. There's kind of two ways to approach stress, which is what you can do to reduce your reaction to stress when it happens, what you can do in the moment, and what you can do to recover from it. Does that make sense? One of the things about this list here is many of the things on this list are things that help you both have less of a detrimental stress reaction, so make you more resilient if you encounter stress, and they also help with recovery. So if you're a regular exerciser, and often this is thought of aerobically, but weightlifting actually helps too. But regular exercise, yoga and Tai Chi in particular on top of aerobic and strengthening exercise have been shown to really help with stress. Meditation, which if you're looking for, again, back to the YouTube, there's a lot of free meditation programs that are very sound that you can actually learn to do on YouTube, even if somebody's got joint issues or pain issues. Meditation's available. Deep breathing, has anybody heard of box breathing? It's okay for the Navy SEALs, it's okay for us too, right? So you got everything back there, you're great. But if you go online, you can learn how to do the deep breathing exercises that are called box breathing. Those are things you can do in a meeting and nobody's going to notice if you're having a stress. So those are things, same with meditation, those are some of the techniques you can use in the moment as well. Guided imagery and biofeedback are helpful. Connecting to others and practicing positive talk. So maybe not in the immediate, but like we've all heard walk it off and talk it off. They work. That's why we talk about them. As long as we're in a positive setting, those are things we can do adjacent to stress. We might not be able to do it, in the middle of a family confrontation, but hopefully soon. So the idea is these things done practiced first make them comfortable. They actually make you react better to stress. There's tools, if you're used to using them, you can use in the moment, and they actually help you recover from stresses. Don't underestimate these tools. The other piece that is this is back to that problem-solving piece with chronic disease management programs. The other piece is, how many of you have had a stress, whether it's a work situation, a family situation, a social situation, that you've been in more than once and you think, oh God, we're doing this again, whatever this situation is. I got all the hands up in the room, right? So this is back to where we might have more influence than we think. We can respond differently by either acting differently preceding a stress, acting differently during a stress, acting differently after a stress. We may not be able to eliminate all stress, but we can often eliminate some stress, and we can certainly reduce others. So this self-leadership concept of problem solving and decision making and planning really can help us be happier. And these aren't squishy, these are very practical things. So when we think about stress management, I wanted to just kind of put those domains up, because if you feel well, if you're sleeping well, if you're connecting socially, if you're exercising, and back to the skill set, and makes my little internist heart happy, making lists, right? Helps us to know. I always say make a list and then put down the things you know you're not going to do on the list, even though somebody says you should. I love making a list and going, yep, not those 5 things, not happening. Not in this universe, not clearly in this week. It's very freeing. So these pieces of stress strategies are really important for your overall health, because back to that self-care, making that doctor's appointment, going to the doctor's appointment, getting to that exercise time, whether it's with yourself and your TV or whether it's with a friend in the metro parks, we can't plan it if we're always reacting. We just can't. And then being proactive, right? The last piece I'm going to do here is the self-acceptance piece. It's such a big deal for so many people. Has anybody heard of Brene Brown? Anybody here? I got some videos. I got my 3 people who are up on all the time. So she's done a lot on shame and other things. Really interesting PhD from Texas. But one of the pieces is one of the reasons, if we really find we're struggling to kind of do our own care, sometimes it's because we really have this persistence of I'm not good enough and I'm failing. And it's real. And it really does get in the way of our help. And it's private, but it's not shameful. And there's safe places to work on this. And so while people go through it alone, it's an incredibly common human experience. And so one of the pieces is acceptance doesn't mean you think you're perfect. And acceptance, Lord knows I wish it did, doesn't mean I don't have stuff to do, right? There's always stuff to do. It just means you can be okay with where you're at right now. Because if you're never okay with where you're at right now, it's really hard to do the next thing and not be pulled down by that. And so self-acceptance has really strong links to health. And so if you really are finding that as you try and make this journey, as you try and do things for yourself, as you try to be kind to yourself, that you're bumping up against something. I just point out, one of the things I know about your benefits coverage is and you guys are in really high-risk jobs, is it really does have good coverage for counseling. And now counseling can be available back to childcare and other care by video, right? And I'm not saying sometimes you don't go three-dimensional, but it can get you there, right? So I really encourage, I was taught, and the evidence is there, strong people use tools. These are effective tools with a lot of science behind them. And so I just would encourage people, if they're struggling for that, do it. Caring for others is a big part of our lives. Social isolation is bad, but it should not harm the giver. And there's some ideas with coping in here that people can look at later if they are bored or need to go to sleep, that, you can print this out, and if you want to go to sleep, it'll get you right there. But again, this is just the lifestyle pieces are there. The last thing I want to say, because it's my favorite part, is part of the things for stress reduction include things that the city's really good at. One is the arts. So it turns out experiencing art is good for our health. Doing art is even better for your health. So me playing piano badly is better for me than listening to the Cleveland Orchestra, even though we have no issues about who has the better skill, right? And so I bring this up because arts are really important. And part of it is, the other thing that's been shown is play. So people playing intramural sports clubs, playing games at home, play matters. It actually frees our brains up and lets us put things down. So I did want to point out some resources at the end there for mindfulness and meditation, connecting well to others, but also the arts. And in this city, we have no shortage of options for the arts. So I'm going to stop there. I don't think I went way too far over. Thank Alita and Tamara and all of you for having me here today. I feel like this is pretty sacred ground, and where it's your time to think about taking care of yourselves. And I will entertain any questions. What is your question? Here, does this work? Oh, he's got one. There you go. You can pass it around.
Thank you very much. So a couple of things. I'm interested in alternatives to pharmaceuticals, such as holistic treatments. Would be interested in trying some acupuncture and things like that. Can you comment on where those fit in and what does Metro offer?
I can. We do not have like a lifestyle specific program, and we have the lifestyle change program, like for diet and exercise, that kind of stuff. I'm going to address the acupuncture first, and I'll deal with supplements second. It's just a little more complex. Part of the issue, so again, I'm pretty science-based. Acupuncture has had good studies that show that particularly for some pain issues, it's effective. And the way to think about that is every medication, whether it's an exercise medication, a counseling medication, a pill medication, they all have a length of time they last, right? They're not forever. Acupuncture is like that too. And everybody responds differently to things, right? But like for back pain and things like that, certain types, if there's not neurologic risk and things like that, acupuncture done by certified acupuncturists has been shown to help with that. One of the difficulties is just regionally. We don't have a huge population of certified acupuncturists in the area. We have some. And I say this because I have siblings who live on the West Coast where there's a huge community of acupuncturists. It's just a totally different thing. So, I know there's some that some of my colleagues say are good. I would have no way to gauge it. So I know in studies and journals, it's shown to be effective and not harmful except to your wallet. I know, it's used for some other things too, but the most well-studied things have been pain-related. There's been stress-related things and other things like that. But so does that make sense? And the reason I bring that up is this kind of leads to supplements. And I just want to point out that everything is chemical. Water is chemical. Everything's got a chemical formula. Back to the supplements. I read the stuff on supplements along with the other things. One of the things I have concerns about, I look at supplements of one of three ways. Might cause harm, not likely to cause harm, but won't hurt you, right? And might help you. But one of the basic concerns I have, which is separate from what the evidence is generally speaking, if you have a bottle, I'm just going to make something up, of fluoxetine, so it's an antidepressant, which has been around for 30 years and costs $4 a month, and has buckets of evidence that if it works in you, it will keep working and it's safe. If you go to the drugstore and get fluoxetine, it's going to be fluoxetine. One of the problems with supplements is because they're listed as food and not drug, on that ingredient label, you may get what's in there. You may get none of what's in there, and you may get stuff you didn't count on. For instance, there's been men's vitality stuff for years that has had, Viagra and other stuff in it, even though it says it's all natural supplements. They are not regulated. They are not legally required, essentially, to be what they say they are. Pharmaceuticals are. And so there is a risk to supplements in a good faith way. And there are some, so when you get vitamins, and there are some that have, standards. The other piece to remember is they're not always the same strength because, again, they're not made at chemical grade. So if you get, for instance, St. John's wort for depression, I'll just use that one because it's been around forever, and it may have some help, but you need a steady dose. 100 milligrams of it this month might be a different strength than the 100 milligrams of it another month because the plant has different concentrations in it. And so the difficulty with supplements, and again, I'm not against them or for them, I'm looking at the evidence, is that they can be unreliable in what they are, and they can be unpredictable in what they are as well. And so it's difficult. It's especially when you start to have treatments that so clearly change lives and outcomes. And back to the holistic part, my patients will tell you what a pest I am. Back to, we'll go use high blood pressure. I never tell people to just take a high blood pressure pill. You need to be walking 5 times a week. You need to be working on stress. You need to be eating differently, which, by the way, is the biggest medicine we take every day, right? Is the food we put in our body, gram for gram. I don't know if that answers your question, but the piece on those things, and pain medications too, it's, dealing with stress and pain medications, that's a whole other piece. You need coping skills as well. So again, I have hopes, and there are some supplements that have turned out okay, but things that were huge when I was in medical school, like glucosamine for the knee. When they really went up to study, head-to-head on studies where the drug company wasn't paying for it, it really didn't make a difference. And so that to me is the issue, is if the person putting out the study is the person who gets paid for it, it helps their wallets, but I'm not sure it helps the person in front of me. They cover, well, I don't know about cover, people have their own, well, but I mean, if you need depends on how it's done, because it's CVS who actually does that. I think some of them cover vitamins, like so iron is covered, or vitamin D is covered, or vitamin B12 is covered, that kind of stuff. I don't know of any other supplement right now beyond what would be in the vitamins or micronutrients, magnesium, things like that, that has the level of evidence that it would be covered at this point. Other questions? And if there's any on the chat, please feel free to let me know. Yes, ma'am. Oh, I'll repeat the question unless she's, Tamara's getting her steps in. We're good.
I feel for myself, some of the things that I've noticed lately in my body, weight gain, emotional changes, or, whatever, may be more about perimenopause. And so when I look at...
Which I think actually is an evil plot, just for the record.
When I look at the benefits and things like that, I don't really see a lot of information about that. Maybe, lunch and learns or whatever Metro may offer.
We have some great OBGYNs who are really good at that.
Okay, so that was my question.
I was going to say, let's get a ladies' change of life issue kind of thing on the work for this year. And in general, back to your kind of holistic approach, irritatingly, and I say this because everything about the perimenopausal state is irritating, sleep, which is now interrupted, exercise.
Emotions are high.
Absolutely.
I'm exercising like crazy and gaining weight instead of
absolutely.
losing it.
And getting into the weightlifting and that, and working with an OBGYN. In some cases, it might be right to be on hormone therapy to get some of that, preserve your muscle and preserve your sanity kinds of things. But I'm going to let my colleagues talk more about that, but that's a piece. One of the alternative ones I did want to mention, which is a musculoskeletal one, for some people, deep tissue massage, you mentioned the pain issue and you mentioned holistic, absolutely can be helpful. Most plans don't cover that, I don't think, but I will say that I want to give a shout out. We do have a really pretty good massotherapy community here. We don't have a huge acupuncture community, but we do have a pretty dedicated massotherapy community, and that can be really helpful for people as well. So that's another kind of holistic approach. Other questions?
Compiling a list of future talks, health talks, and lunch and learn. So this is great. Any other questions for Dr. Seeholzer?
I have trouble with sleeping. And when I spoke to a doctor about it, he wanted to throw some more pills at me. I'm peeled up to here. Is there something I could do? Because I can sleep and wake up later or wake up in the midst of sleeping, and I have a song in my head, and then I can't get rid of it.
So I want to thank you for your question. And while I'm going to keep remarks general, you've actually just highlighted like 7 things in my talk, and I didn't even pay you to ask that question. So first of all, you get to tell a provider. As a matter of fact, I depend on my patients to tell me things. That I'm done. I can't do another pill. That's not the approach I want to take. So that's number one. And it's really important. One of the things about interactions is the more frank you are, the more it's going to be tailored to you, right? You are the expert on you. I can't know how you feel. I can't know what you think. I can't know what's going on. And you spend 30 minutes in my office and a bajillion hours in your life, right? I mean, there's no comparison. So you're the expert on you. And so anytime you are with a provider, it's really important to say, I'm not looking for a pill here, I'm looking for options. One of the things in it may be that you need to go back to them or go talk to a sleep doc, depending. Sleep is, back to our friend over here too, sleep is complex. Our hormonal changes can wake us up at night. Our shoulder pain can wake us up at night. Our bladder can wake us up at night. Sleep apnea can wake us up at night. As I mentioned earlier, our dogs can wake us up at night, right? And our partners, but the dogs. And there's the trouble getting to sleep. There's the trouble staying asleep. There's the what's in your head when you try to go back to sleep, right? All of that stuff. One of the things I will say over time, and that might be why it might be helpful to talk through it with a sleep doc. And I would give you an easy answer if I had it, but it's a good discussion point. Is a lot of it actually comes with tracking and discussing, like, do you notice things about the nights you sleep badly, and can you write those down? Do you notice, are you drinking more fluids before you get up? God help it, would be great if it was that simple, right? Or, is it days where somebody exercises more? Is it days when actually I haven't exercised and my body's kind of more likely to get muscle cramps? So there's kind of this whole piece, and a lot of times sleep in particular, I call it a game of inches. Sometimes it's, multifactorial is the fancy way to say it's a bunch of stuff. And so, and it's gotten to the point where it's really interrupting you. But sleep's a big deal, and I really want to point that out. One of the things with sleep apnea, which we get about 5 to 10 times the risk for after menopause, back to that change of life thing, is that it can be very sneaky. And if that's the case, even you get to decide how it's treated, but it would be good to find out about it. And again, that's going to be a sleep professional. So I would encourage anybody with recurring sleep stuff, initially talk to their primary, but really have a discussion about it. Sleep is complex. I know that was so not helpful, right?
They did diagnose me with sleep apnea. I did all the different types of masks and all of that. One night, my nose started bleeding, and that's what deterred me from.
So let me come back to that. So 3 things. When we have sleep apnea, we're tired. So at least you know why you're tired, in part. The good news, compared to when I was doing this 15 years ago, is there's a lot of options other than just the masks. There's actually, and now insurance is covering too. There's the dental things you can put in now in your mouth. Not an implant, but like it's just stick it in your mouth that can keep things open. There's a sub-Q implant. There's other treatments now. And again, I would talk with a sleep person, because untreated sleep apnea, as we talked about earlier, leads to tough stuff. But what I would not give yourself a hard time about is I find with probably about 20 to 30% of people with sleep apnea, it is a process to figure out what works for you to manage your sleep apnea, because it's everything from the nasal passages, right, to the comfort to the mask, to whether you feel claustrophobic, to whether it's easier to just put something in your mouth that you bite on because that's not such a big deal. I mean, everybody's different, and the masks, there's a lot more masks than there used to be. So what I would encourage you, back to that mindset, is to not give up and keep being curious and really working it through, because they have a lot better tools than they used to. So I appreciate you bringing it up. Thank you.
So I have a question.
Yes.
Regarding lupus and autoimmune issues.
That will probably need to be a talk that is so not my expertise, but go ahead.
A general question
Okay.
regarding lupus and autoimmune issues. So if you have an autoimmune issue like lupus or fibromyalgia, Raynaud's, Sjogren's, whatever, and you have joint issue and muscle issues and stuff, how do you start to exercise to overcome the joint issue and the pain and the muscle issue? Because you can't move.
The answer is it depends on you or the person with it. In many cases, and I will just say this about people with chronic pain, and fatigue. I mean, right, autoimmune stuff, there's generally pain issues and fatigue issues. And, my patients have taught me 3 things. One is they have to find a way to exercise that makes them feel better, but they're not going to feel good doing it. They're not going to want to do it. They're just going to notice over time that it improves things and it doesn't decrease function. So for many people, it ends up being water exercises because they can temperature regulate better. For some people, it is what we call short bout exercises. So they need their equipment at home because maybe they have to do non-impact stuff, but they can do 10 minutes on their bike twice a day and work up to that. And maybe it's 3 minutes twice a day to begin with. But if they get overheated, it might make things worse. So it's really working through patterns of increasing tolerance and noticing benefit. And, a little fatigue is one thing. You can't get wiped out for 3 days afterwards. So it becomes this very gentle kind of push-pull relationship. Another one is POTS syndrome, where people get lightheaded with it. And for a lot of my folks with that with temperature regulation, they really do need the water exercises. So it really is back to creativity, kind of like you were talking about with sleep, right? There's a lot of trial and error for you as an individual and kind of being creative about assets. And you can have 3 people with the same diagnosis and they won't tolerate the same plan. We really have to kind of work on things and say to somebody, do you have any other ideas? So great question. And, you know, again, it's worth persisting in, but I'm not going to pretend it's easy, but it is worth it.
Thank you, Dr. Seeholzer. So for those of you who are remote, we're going to put a slide up that has the code to get your points. And just a couple of pieces of information that if you have questions, please email County Wellness Committee at cuyahogacounty.us. That's County Wellness Committee at cuyahogacounty.us. And finally, I know I said thank you, but I found that very interesting and fascinating. And we have the slides available for anybody who wants them. So please email County Wellness Committee at cuyahogacounty.us to get the slides. And we look forward to everybody finishing those health risk appraisals. And that would be great. And also, please keep sending in your ideas and your information and telling us what you need. So thank you, everybody. And here's the code.
If you advance the slide, I think it's one more, press the green button. Oh, there it is. Yay.